Hi, it's me again, Dr. Felipe Cabrera, Vargas, vascular surgeon from Bogota, Colombia, and Dr. Maria Diaz in the camera, surgical intern from Bogota, Colombia, Fundación Santa Fe, Bogotá, Universidad de los Andes. We are here again in the BGS Academy, Surgical Instruments and Basic Surgical Techniques, and we are going to speak today about the Mayo scissors. The Mayo scissors were designed and developed by doctors William and Charles Mayo during the 80s in the United States. Dr. William and Charles Mayo are the founders of the renowned Mayo Clinic in Rochester, Minnesota. They were an amazing and marvelous and very influential Fargot and endocrine surgeons, and they invented the Mayo scissors to create an instrument that will be used to cut non-organic materials. So the Mayo scissors have a lot of size and shapes, but this is a mini Mayo scissors that we have today, but it's perfect to show how to use it. And this Mayo scissors, we can use it with two techniques. One is the finger grip that we see here, using the first and the fourth finger to activate the mechanisms of cut of the scissor, and the second and first finger to give stability and precision to the cut. So when we use this technique, I recommend to when the second surgeon or the surgeon show you the suture to be cut, you have to use your non-dominant hand to put an extra of precision and stability to the Mayo scissors, because these scissors have the ability to create a big damage if we use it on organic tissue, on the foregut, on the vascular structures, etc. So when we are going to cut, we have to cut only with the tip of the scissor, because if we cut with the mid of the scissor or the end of the scissor, we have the risk to injury structures that are more far of the suture. So we have to cut only with the tip of the scissors. Okay, so here we have a very special point to have a better use of the Mayo scissors. All the Mayo scissors have two edges that are the edges that cut, and we have to improve the friction between these edges. So when we use the finger grip, we have to push forward and push back with the first and the fourth finger to improve the friction with that edges, and with that augmented friction, we are going to have a very precise cut. Okay, so the other way to improve that cut of the Mayo scissor is to take the scissors and the suture and give an angle to the scissor. So we are going to create more friction, and we are going to improve the cut of the scissors. So both techniques are valid. You can choose what is worth better for you. And the other technique to use the Mayo scissors is the palming. Okay, we use the non-dominant hand, and we use the forefinger, the first finger and the fourth finger, and we perform palming. Okay, we use palming when we cannot use our dominant hand, and we use the same. We have to push forward and push back to improve the friction of the edges of the scissor and perform the cut. Okay, and we can use both technique, or only a regular cut, or give it an angle to the scissor and perform the cut. Okay, thank you very much. We have happy to the success of this new educational series of BGS Academy, and we are going to see you in the next video. Thank you very much.